President Ronald Reagan once said, the 9 most terrifying words in the English language are, "I'm from the government and I'm here to help." The government often causes more harm than it does good, and that is particularly true when it comes to health care. Thankfully, America is filled with innovators and problem solvers, and today we'll hear from some of those leaders on these important topics of lowering prices for quality health care. The cost of health care is one of the greatest challenges our country faces. Last year, health care spending reached $4.5 trillion, costing over $13,000 per American citizen. Meanwhile, Medicare is set to become insolvent by 2031. In 2023, federal subsidies for health care insurance are estimated to be $1.8 trillion, or 7% of our GDP, or gross domestic product. This has led to premiums drastically increasing for commercial insurance. The other side doesn't seem to understand that when the government subsidizes something, it actually becomes more expensive. It merely shifts the cost from the patient to the taxpayer. In my district in Campbell County, Virginia, premiums for a family plan have increased 81%, or $9,000 over the last decade. So much for the claim that premiums will go down with the Affordable Care Act. The Biden administration's plan is to increase spending and impose more mandates, which will only result in more inflated health care prices, further bankrupting our country. Today, we're going to learn from innovators in the business world who are delivering savings to workers through lower health care costs, while still providing timely access and quality care. Employers not only have a strong incentive to deliver high-quality benefits to retain their employees, but they also have a legal fiduciary obligation to do so. Unsurprisingly, 67% of Americans are satisfied with their employer-sponsored care. But sadly, the system is rigged against employers who want to pursue value-based models. It takes time and resources for healthcare innovators to overcome the significant economic and regulatory barriers in place across the country. We can learn a lot from the witnesses here today, as well as from other innovators who are working to overcome these barriers and teach employers how to use innovative models as well. In 2012, Walmart, the largest private employer in the world, launched its Center of Excellence, or COE program, which directs patients to specific sites and providers for specialty care. Since the launch of Walmart's COE program for spine surgery, Walmart has found that patients who underwent surgery at a COE had a shorter hospital stay and drastically lower readmission rates, and that patients returned to work sooner than non-COE patients. For the 2017 benefits year, it's estimated that Walmart, Lowe's, and McKesson saved $19.4 million through their spine and joint surgery programs. Schweitzer Engineering Labs, which is represented here today, saved nearly $2 million in 2023 by participating in innovative models. California VEBA is also represented here today and has drastically slowed premium growth in its plans, and its beneficiaries have reported a 94% satisfaction rating. The Boeing company also engages in direct contracts with doctors and health systems, effectively bypassing insurance companies. One study found that patient cost sharing decreased expenses per procedure by $498 for orthopedic and surgical procedures when using the direct contract model. However, many barriers still exist, which make it especially difficult for small and mid-sized employers to use these models. One barrier is a lack of data. Employers often struggle to access their own health plan and spending data from their third-party administrator. Without this information, employers and providers are unable to adequately design innovative payment methods and assess quality and savings. Another barrier is the overzealous state regulators who threaten to prohibit or overregulate payment models that allow for provider risk sharing, even when the payment is between a self-funded ERISA plan and a provider. Some states even try to regulate these self-funded ERISA plans as insurance carriers. Furthermore, inconsistent quality measurement standards pose a challenge in the healthcare market. The lack of reasonably established cost and quality benchmarks can be a challenge for employers, providers, and third-party administrators. These barriers often translate into administrative burdens, costing time, money, and personnel to navigate and overcome. These are administrative burdens that many small and mid-sized companies do not have the resources to cover. One solution would be to allow employers to take advantage of economies of scale by permitting them to join together in one direct contract with a provider. Another solution could be to strengthen data sharing requirements, as this committee has done in the provisions included in the House-passed Lower Cost, More Transparency Act. The federal government could also clarify that ERISA self-funded plans can participate in innovative payment models without being targeted by overzealous state regulators. These are just a few of the ways to address barriers employers face today. Our witnesses will speak more about the different challenges and solutions that Congress can consider when providing space for our healthcare innovators and business owners. I look forward to today's discussion and seeking ways to create more pathways for lower cost, high quality, and innovative healthcare. And with that, I yield to the ranking member for his opening statement.